Now, despite the number of deaths and new cases reported by the state health department today, we've learned during Governor Holcomb's press conference the coronavirus situation may actually be getting better across the state. Here's what the health commissioner had to say.
I hesitate to say this, but I do think we may be seeing a flattening of that curve. We may be seeing that peak flattened and that kind of plateauing effect. That may not be in every area, but we've actually, in some areas in the southeast, seen their numbers of hospitalized patients, of ventilated patients fall. As you can look at our ventilators and our ICU beds, they've actually only gone up over the last week to 10 days in Marion County. So I'm cautiously optimistic that everything that we have done has really tremendously made a difference.
Big talker today is about Indiana Congressman Trey Hollingsworth. He happens to be a Republican who represents the 9th District here in the state of Indiana. And right now he's facing scrutiny for comments he made about reopening our country after the stay-at-home order and the coronavirus epidemic. Mary Mills explains why some people not so happy with the congressman's comments.
Indiana Congressman Trey Hollingsworth facing growing backlash for comments he made on WIBC Radio Tuesday. Talking about the economy, he said Americans need to get back to work, even if easing restrictions means losing more lives to the virus.
The social sciences are telling us the economic disaster that is occurring, down 20% this quarter alone, our GDP is expected to be. It is policymakers' decision to put on our big boy and big girl pants and say, this is the lesser of these two evils, and it is not zero evil, but it is the lesser of these evils, and we intend to move forward that direction.
His office later issued a statement saying it's not a choice between one or the other, adding, we can use the best of biology and economics to enable as much of the economy to operate as possible while we work to minimize transmission of the disease. Today, his Facebook page was full of comments, more than 1,500. While one person wrote, thanks for standing up for Americans and voicing our thoughts. All businesses are essential. Let's get back to work. Most posts were critical. One person saying, this is the most unchristian attitude I've heard. Economy before life? You should be ashamed. Another simply wrote, vile. While someone else said, I think you will regret these words when someone you care for is struggling to survive COVID-19.
And Mary just spoke with the congressman a few moments ago. We have what he is now saying about those comments coming up as our coverage continues tonight on Eyewitness News at 6.
The Howard County Commissioners are now throwing small businesses a lifeline tonight. Some of the so-called non-essential businesses are now being allowed to reopen. Our Rich Van Wyk explains why tonight and who will benefit.
Shenandoah Stipe is grooming her own dog today. Friday, she'll be back in business, caring for other people's pets.
Oh, my husband and I were jumping for joy. It was like the best news.
The small business, like many others in Howard County, were shut down by the COVID crisis a month ago.
I was downright devastated. It took me a couple days just to recover from seeing a third of my income gone.
The county commissioners have decided to allow pet grooming shops, car washes, and a short list of other so-called low-risk businesses to reopen.
We're not doing opportunities for people to have gatherings or go inside of these businesses and hang out.
Howard County had some of the toughest restrictions in the state, even tighter than the state's restrictions. To keep shoppers from crowding into big box stores, the commissioners banned the sale of non-essential items.
We have had some of the toughest restrictions in the state, and we're also having a lot of success here in Howard County in flattening the curve.
Marie's Car Wash lost about $14,000. Reopening will put Scott Neer Gardner's employees back to work.
I do have a couple families that rely on my business to put money on food on their tables.
We're really happy to be back.
Stipe's appointment book is filling up, but she doubts they will recover the lost income.
No, when it's gone, it's gone.
Apparently, there is no getting back what the COVID crisis is taking away.
Those changes also bring Howard County's restrictions in line with those put in place by the state of Indiana. Families who need help during this pandemic will have more assistance from local food banks. The Disaster Household Distribution Program uses food from the Emergency Food Assistance Program. There are about 250 sites will help distribute food across the state. Here in Marion County, they're using IPS buses along with community centers and Gleaners Food Bank to help families in need.
Purdue University plans to graduate 144 pharmacy students on Friday. That is about a month early. It's really about a plan to help stop a possible shortage of pharmacists during this pandemic. Our Rich Nye today talked to one of those students from Fishers about filling the need for people to fill their prescriptions.
Emily Vaheri from Fishers has spent most of the past year learning in pharmacies and hospitals, meeting all of the license requirements for work experience. She joins Purdue fourth-year pharmacy students allowed to graduate a month early. Why do you want to be a pharmacist?
I really enjoyed chemistry, and a family friend suggested it to me when I was in 6th grade, and it kind of stuck since then.
Purdue approved early graduation to help students get a jump on their license exams and cover a potential shortage of pharmacists during the COVID-19 outbreak.
We know there are a lot of unknowns about the next several months in front of us. We know that our students are well equipped and are committed to providing patient care and provide that care regardless of the situation.
Moving into the healthcare field right around the time that this pandemic is happening will be a great learning experience for me as well, because I really enjoy infectious disease. So this is actually kind of fascinating to me.
Emily spent 2 months last summer working at a hospital in Kenya that treats widespread HIV infection. She was also exposed to tuberculosis. She assumes she was exposed to COVID-19 many times, working at a retail pharmacy.
Eventually, we'll be able to find some sort of treatment for this disease, and we'll be able to contain it. Most likely, we'll have a vaccine eventually. So I'm really just trying to keep a positive attitude at this point.
Emily begins a residency at the University of Iowa Hospital after graduation.
Now, the testing center for pharmacists to get their license are expected to reopen in early May. But Purdue right now is hoping that there will be a temporary pause, if you will, from the governor to grant temporary licenses to these graduated students. This is something he has done for other medical fields as we continue to move forward during this pandemic. Also today, about IU. They had some medical students that graduated there, Scott.